So, today we're going to be taking a look into trauma and how it can affect a person's life. What is trauma? It is the response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope. It causes feelings of helplessness, diminishes a person's sense of self and their ability to feel the range of emotions and experiences. Trauma overwhelms a person's coping capacity, and for some people, it will have long term effects on functioning and a person's being. There are many events that may cause trauma in a person's life. Some events that may be traumatic includes experiencing or observing physical, sexual, or emotional abuse, childhood neglect, having a family member with mental health or substance use disorder, war, poverty, or sudden separation from a loved one. Many people may not be aware of the impact that trauma has on a person's health. Experiencing trauma, especially in childhood, can actually change a person's brain structure, which in turn can contribute to long term physical and behavioral health problems. Children and adults often develop unhealthy coping mechanisms to ease or cope with the pain of trauma. Such coping mechanisms can be overeating or eating unhealthy in general, using tobacco or other substances, or engaging in risky sexual activities. There are many other unhealthy coping mechanisms that may use, but these are just a few. Response to a traumatic event varies significantly from people to people, but there are some basic common symptoms which can either be emotional signs, physical symptoms, or psychological disorders that people will show. And I will now get into these. Some emotional signs may include sadness, anger, denial, fear, or shame. And very often, these signs or experiencing these symptoms may often lead to nightmares, insomnia, difficulty with relationship, or emotional outbursts. There are common physical symptoms that a person who has experienced trauma may show. Some symptoms may include nausea, dizziness, changes in sleep pattern, changes in appetite, headaches, or even gastrointestinal problems. Some medical conditions may even develop such as liver disease, chronic lung and heart disease, liver cancer, autoimmune disease, hepatitis, diabetes, or even hypertension. Many people who have experienced trauma may develop psychological disorders. Some disorders can be post traumatic stress disorder. This is a condition triggered by a terrifying event, either by being in it or seeing someone go through it. Symptoms may include flashbacks, nightmare, anxiety. Symptoms may also include uncontrollable thoughts about the event. Depression. This is characterized by persistently depressed mood or loss of interest in activities. As a result, it will cause significant impairment in daily life. The following may also be observed: changes in sleep, appetite, energy level, concentration, daily behaviors, or in self esteem. Depression is also known to be linked to suicidal thoughts. Anxiety. There are different types of anxiety, but anxiety is characterized by feelings of worry or fear that is strong enough to interfere with one's daily activities. Symptoms include stress that's out of proportion, inability to set worry, and restlessness. Other symptoms may include irritability, lack of concentration, racing thoughts, fatigue, sweating, pacing, insomnia, or trembling. Substance abuse. This drug addiction is a disease that affects a person's brain and behavior. It leads to health issues or problems at work, school, or home. It leads to an inability to control the use of a legal or illegal drug or medication. Substances such as alcohol, marijuana, and nicotine are some examples of drugs. So, a person who have experienced trauma, these are some psychological disorders that may develop. There are many other psychological disorders that may develop when a person experiences trauma. Common experiences to trauma. Emotional. After the initial response to trauma, meaning the initial response that one may have experienced after experiencing trauma or witnessing it, feelings of anger, fear, sadness, and shame may surface over time as well. Strong feelings associated with past trauma may cause an individual to feel as though they may be losing control again. Emotional dysregulation. This is where a person may have difficulty regulating emotions such as anger, anxiety, sadness, and shame. As a result, the person may turn to certain things to cope, such as self medicating, self injurious behaviors, disordered eating, or even engage in compulsive behaviors. Numbing. This is a biological process where a person's emotions become detached from their thoughts, behaviors, and memories. Now, in order to truly understand the impact of trauma, we must also talk about the importance of trauma informed care, what it is, and why it is important. So, with trauma informed care, it is important to recognize how common trauma is and to understand that every individual or person that we come across may have experienced trauma. Trauma informed care, we recognize the presence of trauma symptoms and acknowledge the role that trauma may play in an individual's life. The intent of trauma informed care is not to treat the symptoms related to trauma. We're not here to treat anyone's symptoms, but instead, we're here to provide support in a way that is sensitive and appropriate to those who have experienced trauma. Trauma informed care is the open mindedness and compassion that all individuals deserve because anyone can have a history impacted by trauma. This approach of trauma informed care is striving to understand the whole individual that we are providing services to. When trauma occurs, it is important to understand that it affects an individual's sense of self, their sense of others, and their beliefs about the world. Trauma can change a whole person, and these beliefs that a person may have can affect an individual's ability to connect and utilize the support services that are provided to them. Trauma informed care has many aspects to it, but I wanted to just talk about it briefly to bring understanding to what it is and why it is important, especially with the individuals that we work with. Now, here are some ways we can offer support that is sensitive and appropriate. Ensure safety. Create a space where the person feels culturally, emotionally, and safe, as well as having an awareness of an individual's discomfort. Ensure trustworthiness. You want to develop rapport. You want to develop a relationship with the individual. Be patient, be empathetic, be understanding. Communicate, and remember not to make false promises. Choice and collaboration. You want to offer as much support and options as you can. Not here to control anyone. So, the more options and support that you offer, the more you will give the individual a sense of control. Remember to honor a person's dignity. Work together through collaboration, and the individual will more likely participate with services and the more effective the overall outcome. Empowerment. It's important to recognize their strengths. We all have strengths. And empower them to build on those strengths while developing stronger coping skills. This will help to build resilience with our individuals. Remember to also always provide validation. Recognizing the effects of trauma is important, but it's also important that trauma is treated. Survivors of trauma are everywhere among us. No matter what the specific trauma may have been, the result is the same: trying to mend a life shattered by trauma. One of the most important parts of treating trauma is ensuring that the recovery program is going to provide a safe environment for healing to occur. One of the major hurdles that a person will need to get through is reducing the shame and painful and perceptions around trauma. It is also important to understand that a person affected by trauma will take time to heal. There is no specific time frame on how long this will take. And having an unrealistic expectation or pushing a person beyond his or her readiness will not help. There are many treatments for trauma. However, it is important to understand that treatment will look different for everyone. Some common treatments are psychotherapy, stress management, meditation and yoga, exercise, or medications. The healing process of overcoming trauma will take time, but with the right treatment and being in a safe environment, a person will be able to overcome the impact of trauma.